Welcome once again to The Sage. Thank you for being with us, and thank you for tuning in again once more to listen to us, to discuss with us, to share minds with us on issues, as usual, that we consider extremely important. For me, as the sage, I have spent a great deal of my life surmounting barriers of place, of circumstances, of education, and so on, in an effort, an attempt to achieve my dreams and my goals. And I must say that one of them has been the issue of race, the issue of discrimination, sometimes overt, sometimes masked. It can be race, it can be tribe, it's all there no matter where you are. But in this particular series of episodes about to unroll, I had reason to be more keenly aware of the effect of racial discrimination on many, many people in the world. And I will be blunt on the fact that many times in life, being black makes you not only different, but oftentimes proves to be a challenge in your life, no matter where you are. Sometimes when an issue becomes so glaring and so blatant, the UN brings it to special attention by mobilizing the global attention to the issue at hand. And for us in this particular episode of The Sage, it is the issue of the problems that being black causes for so many millions of people across the world. And in recognition of that fact, the United Nations, as it often does, declared a decade of what it called the UN International Decade for People of African Descent. And because it is so crucial, I want to read from the UN text itself. In December 2014, to be exact, the Secretary General declared a decade of treating issues of people of African descent. And that decade, believe it or not, started in 2015. It's actually supposed to pan out in 2024. What is the UN International Decade for People of African Descent? According to the UN, it justifies this by saying that across the globe, Africans and the Africans in the diaspora continue to suffer inequalities and disadvantages because of the legacy of slavery and colonialism. I want to emphasize that slavery for millions of people of African descent across the world, but also issues of colonialism, particularly within the African continent, that continues to leave effects that are far-reaching, that in a way contribute to the problems the African continent is still undergoing. Recently, I was invited to what I call a remarkable conference in Halifax in Canada, Halifax, Nova Scotia. I had the privilege of being invited to participate in the National Black African Summit, hosted by the Mikhail Foundation. Mikhail is an amazing lady, the 27th Governor General of Canada, who, as a lifelong commitment, decided to set up this foundation to fight the injustices people of African descent everywhere suffer, but particularly in Canada. The summit took place a week ago in Halifax. It was amazing. It took on with courage the many issues that confront those of us with black skin. It saw an outpouring of thousands of young Canadians of African descent, many from Nigeria, but many also from all parts of the world. Amazing, amazing young people. Vocal, strong, determined, fighters. I watched and listened. Keen on taking back lessons learned, not just for other young Canadians who may not have had the privilege to be there, but also very much for the young people in the Africa continent, but particularly in Nigeria. Mike, there were 3 key takeaways for me. They said things that resonated, and so I wrote it down. 1, they came out with one voice, and they said, together, we're stronger. 2, they said, there should never be anything about us without us. And 3, they said, it is not a moment in time. It is a movement that will conquer. Those words were from Mikhail herself. And so for me, to the millions of young people, particularly in Nigeria, but also in the diaspora everywhere in the world, I think those words need to remain with you. Together we're stronger. There should never be anything for you without you. It isn't an issue of the moment. It's a movement that must be followed up, articulated, implemented, and achieved. Halifax produced a declaration. To everyone, I ask you to please go online, download that remarkable declaration in which in details they brought attention to the various sectors that needed equity, equality, improvement, development for young people. And so, having been so inspired, knowing that there's so many wonderful lessons to be learned, I decided that I will maximally use this period in the diaspora in Canada to connect with some of these amazing young people. I am indeed humbled and privileged that so many of them were willing to discuss with me. I think we have a great deal, apart from the contents of or outputs of the conference, of the summit, to also listen to them, because they remain a part of us. First and foremost, they are young people of African descent. As I told them at the summit, I am eternally grateful for having been born an African, for my black skin, for my heritage. We have a great deal to give to the world as Africans. We are the mother of the human race as it is today. There's a great deal to learn from our culture. There's a great deal to learn from our amazing young people who continue to contribute immensely to the development of so many other countries in the world. Stay with me. Join me as we unearth the treasures in our young people. As I begin a series of shows for the next few weeks that would give us the opportunity to talk to these young people, to hear their life story, to learn and gain wisdom from them, and to be encouraged by them, also to work to ensure that the African continent can overcome its colonialism history and be the best that it can. Stay with me in the next segment as we begin to meet some of these remarkable young people. Thank you. Welcome back to The Sage. Thank you for having been with us. But I promise you, it is a show well worth watching. When we broke for our intermission, we told you that we would have this rare privilege of talking to some of the brilliant young people that are of Nigerian origin, who are residents in Canada, working in Canada, and therefore who we proudly own as part of ours, Nigerians in the diaspora. On set today, I have two beautiful, talented young ladies, both of them doctors. And so, of course, our topic of discussion is going to be about health. That's what doctors do. I'm also very pleased to say that for me, it's a subject dear to my heart. After all, I remember my being a doctor, I haven't forgotten it. I've lived it all my life. And therefore, it's a place, it's home, it's a place to start. On set with me today are two busy young ladies, but who have generously agreed to give of their time and talk to you. I start on my left with Dr. Kechi Ozoka, who is a family physician, trained in the UK, both her medical degree and her specialization in family health, and now works full-time for many years. I think it's over 10 years, I think you said?
Yeah, 15 years.
15 years in Canada. Doctor?
Oh, sorry, not 15 years in Canada.
How many years?
8 years.
Okay. It's more than half of 15. But 15 years, especially as a doctor.
Yes.
But 8 years in Canada. Okay. Dr. Kechi Ozoka, thank you so much for being with us.
Thank you for having me.
And I turn on my right to Dr. Ifeoma Achebe. She's a public health and preventive medicine specialist, also based in Alberta, Canada. She, by coincidence, also trained to a certain extent in Nigeria at Nnamdi Azikiwe University in Nnewi in Nigeria, before moving over to the UK to also specialize in the area of public health. I have some very nice, interesting things to say about that. But I did promise you that later in the next episodes, we shall talk one-on-one with these two amazing young ladies, and I will reveal the secret of the fact that I take joy in knowing that perhaps a little of what made Dr. Ifeoma turn to public health had to do with me. So, Dr. Ifeoma Achebe, you're so welcome to the set.
Thank you. It's my pleasure to be here tonight.
And so you've met them. They don't come better than this. Amazing young ladies, brilliant, talented, very hardworking. And making it, because in the end, that's what life is all about. It's understanding your passion, following it, working hard at it, achieving it, and continuing to work to make it a reality in your life. And so I thank them once again for joining us on the set. As I turn to them in this initial intervention to tell us, share their thoughts on many issues from the perspective of being specialists in medicine, in health themselves. And so for me, of course, my first question is going to be, as young people, they are still very much young people, what do they think about young people's health? Do you think health is an issue that is of major importance to young people? Let me preface that question by telling you that as I am growing older, health is my major thought many times. I'm all forever wondering about, do I have good medical insurance? Which do I have a competent doctor? Because more and more illnesses and the state of your health becomes a natural part of aging. What about young people? What is it for you? Do you think health is an issue to be thought about? Who's going to start?
Well, I can start. First of all, very interesting question, because young people always tend to think that they are healthy. That whenever you talk about health, it's for the aging population, the older population amongst us, but that's not always the case. So health, really, cultivating that habit of being aware and conscious of living a healthy life starts at a very early age. Okay, so in as much as health conditions get worse as you get older, things like high blood pressure, diabetes, other chronic diseases come up as you get older. There are still things that can come up, that can happen to younger population, right? So common illnesses, infections, which can be prevented if they know that it can be prevented. Things like vaccination would help prevent them. When young people walking or playing outdoors, maybe playing soccer or sports, any other kind of things, get exposed to. Maybe they get a bruise while playing and they don't have a tetanus shot. They don't consider that very serious, but they can potentially die from tetanus. Mm-hmm. So that prevention mentality, I would say, is lacking in our young people, and it's very unfortunate. But as physicians, we keep doing our best to remind them whenever we come across opportunities to do the same. Other things include precautions for sexually transmitted infections, which is quite common with young people.
If I'm going to stop you there, you said some very important things. Many times young people need to be on top of things that they need to prevent or address early before it progresses to something more serious. And that is so true. We're going to come back to that later as I ask about what should we do about some of these things. But let me turn to Kechi and say, what about you? What do you think in terms of how important should health issues be to young people?
Health issues, young people. I know it sounds alien, but very important. I work in a downtown, my clinic-based practice is based downtown, which has mostly a very young population. And I am very busy. Health is paramount, from the newborns to the school-age children to the teenagers. I echo my colleague, Dr. Achebe, with preventative measures, the checks, the sexual health checks, and I find especially mental health.
Okay.
It goes across all ages, and especially there's a lot more awareness right now. So I find a lot of my practice with the young people, it does come down to mental health. So not just the physical aspect, but the mental health, preventing as well, helping families grow healthy with healthy habits, not just physical but mental habits to promote well-being in their families and children, and then also intervening when things do not go so right.
I find that very interesting because you've just echoed something some of my young fellows back at home in Nigeria in the C4C program talk about the fact that mental health is a major issue. Actually, they keep insisting for young people, and too often in our environment in Africa, it's an area we don't place enough emphasis on. So I take that, I agree with you. It makes a great deal of sense. And because I'm a doctor and not just your moderator, I'm also going to say that to both of you that another area that we might also think about would be the issue of the fact that it's you young people that bear children, it's not us. And therefore the issues of maternal health and so on are, totally, again, the need, right? Am I,
Yeah, you're right.
and so I'm going to lead you further a bit and say, we've talked about some of the major challenges when it comes to health that young people often face. But what about services? In your opinion as doctors, how available are services for young people? I want you to think about it, not just talk about Canada, this is where you're practicing, but also think about home, think about Nigeria, because you're both also still Nigerians, and talk about what you think in terms of how available are services. If they go for mental health, will they get services, and so on. And so where do we start?
So we have services here. We're quite fortunate. We have the Canada Health Act to provide healthcare free at the point of access for every resident of Canada.
Wow.
And that works. I'm a firm believer in that system. I think it works very well. It does have its challenges, but nobody who is resident will be turned away by a healthcare practitioner if they seek medical attention. And
for everything or for mental health?
For everything.
For everything?
Yes. Everything.
That's correct, yeah. That is Canada healthcare for you.
My viewers in Nigeria, I wonder what they're thinking. But please go on.
Because you need a healthy population. Okay? You want a population that is healthy mentally and physically. Because we need the population to work, pay taxes, and help run the country. So having access to healthcare is paramount.
Mm-hmm. Absolutely.
It
sounds like common sense, doesn't it?
It does.
And
yes.
Right.
And yes. And when I was a young person back in Nigeria many years ago, I'm sure things have evolved. I'm not entirely certain. But healthcare is a luxury.
My dear, I'm sorry to shock you. It continues to be a luxury.
It's an absolute luxury, and it's disheartening, it's frightening, and especially when I recall back as a student in pre-med, I remember in the campus they had a small medical center run by an elderly nurse, and all I recall is that she gave injections for malaria with chloroquine. There wasn't much else, and this was a pre-medical campus. So it's quite frightening. And then when I think in general about what the young people in my practice come to see me about, a lot of mental health and sexual and reproductive health. How do you access that? You need the funds, and even if you do have the funds, you need to be able to see somebody, a professional, who is impartial and non-judgmental, who you can see in confidence. Mm-hmm. Young people value that immensely, and without those resources, the young people are in peril. It's very unsafe.
Let me again turn back to both of you and challenge you a little with some of the things I heard in Halifax at the summit, where while what you say on the whole is right and correct, I'm sure, a lot of the black people, young people, or black people at the summit, people of African descent, were emphasizing, however, that that even within that health system in Canada, that there's discrimination, that there's inequality, and there's inequity in access. I want you to address that, because it was one of the contents of the declaration that your black skin confers a different experience on you. You want to address that?
It's very true, and it's very disheartening. There's been lots of research done into this, but black mothers have one of the highest mortality rates with deliveries in the UK, in the US, and here in Canada. As a black person, you're more likely to face discrimination in assessing healthcare. the assumption is going to be made about you without even proper history being taken. And it takes me back to an experience when I was a young physician, an intern, and this was back in the UK. And I experienced a lot of subtle and overt racism towards patients. And the story that still sits with me was I was working in the emergency then. This was in South London, and there was a black woman in a cubicle, and she was screaming, and everybody ignored her. And I remember asking the nurses, "Why is she screaming?" They said, "Oh, well, she's just being noisy." Very dismissive. And I was quite shocked, and I walked in there, and this poor lady was having a pregnancy loss. So she was screaming because she was in agony and pain. But black women, our pain is always minimized. I didn't understand what was going on then, but when I reflect back, that was what was going on. I walked in there, the heart rate monitor was through the roof, and she was hemorrhaging. But she had been ignored and just put in the cubicle and the curtain pulled over. So I called her attention and she got medical attention, but it was the way she was dismissed. Oh, she's just being a bit noisy. And I've had many
Probably because in their mind, Africa, black people like to be noisy.
Yes, and many black women will tell you this. Instances of childbirth, accessing healthcare, and the sometimes even overt mistreatment by staff, our pain being minimized, our symptoms being minimized, assumptions being made by us, being made about us, that we are drug seeking. It's a big problem. Even I, as myself, as a physician who has sought healthcare, I have experienced it. Right? Because when I seek healthcare, I don't tell them I'm a doctor. It has nothing to do with why I'm seeking healthcare. I'm a patient. But it's blatant, and it happens, and it is so, and then sometimes, and then when it happens, I can advocate for myself. So imagine a person who looks like me, who can't advocate for themselves, who doesn't have the background knowledge. Is this happening? So yes, it is a big issue in healthcare.
This is profound, and I'm going to ask you, Ifeoma, to also say your 2 bits about it.
Right.
Because that's the thing about life. It's never perfect, is it? I mean, it's the care you have access to here in Canada is eons away from what is available in Nigeria. But it doesn't preclude the fact that in Canada, as a person of African descent, there are problems.
Right. Of
Do
course.
you own experiences of it?
Yeah, I do. Lots of experience, even as a physician myself, and as, someone taking care of patients. I know years back when I was in my residency here in Canada, there were 2 kids that came in from Africa. I think they were just adopted refugee kids. Mm-hmm. So they came in with malaria and admitted in the ward. Ran the test and came back positive for malaria. And next thing, I noticed that, the nurses ran away from them. And I was like, what is happening? Oh, they have malaria, we can't go in. I'm like, no. Malaria is not airborne, they still need care. So those kids were neglected for the most part, but when I now found out what was happening, I had to step up and help them, and I also tried to educate the nurses. I said, you guys shouldn't do this. Malaria can happen to anyone, black, white, colored, and it's not airborne. So it's one of those things. And even me as a physician, like when I was in training, sometimes when you come in to see a patient, they will ask you whether you're the porter. Meanwhile, you have your stethoscope and your name tag.
The name badge.
Yeah, so it does happen. And honestly, I use that as a teaching moment each time I encounter those people. And because I believe that's the only way we can effect a change, in addition to tackling it systematically. But there's a lot of health inequity when it comes to black Canadians and the way they access healthcare. Sometimes that stereotypes too, like once you come in as a black person, you're here to look for opioids, a drug addict, So it's always it's a challenge, and it's an uphill task, but we keep working on it. I know that a lot of organizations are beginning now to have diversity and inclusion programs, like the organization that I work for, AHS. They do have such programs, and they are saying they're becoming less and less tolerant to such things. So there's always avenues to lodge a report or complaint. If you encounter any such things, and with your proof, you can always lodge a complaint. But as for racism, it is here in healthcare.
Wow. Yeah, we talk about relativity, so to say. Nowhere is life perfect. We acknowledge and admire the fact that, at least empirically, most of you can obtain healthcare when necessary if you're here in Canada resident. But we also do admit to the very real need for there to be real equity and equality in access to services. There's still so much to talk about, but we will continue next week, when we will discuss further with you about the COVID. I don't think any health discussion can happen at this point in history without referring to the impact of COVID, and also talk about the future and about suggestions for actually making things improve, both in Canada and, I always harp on that, back home in Nigeria, where we come from. So don't miss next week's episode, because these two amazing young ladies are going to share more of their insights. Thank you so much for having stayed with us. See you next week.